Hey guys, welcome back. It's Coach Bob here, CrossFit Glen Burnie, and I just saw an article from Time. They published on the CrossFit Precision Care. So we have some new information about CrossFit Precision Care. And so we're going to dive into the article, pull out the highlights, and see what more information we can learn about this new initiative that CrossFit has. All right, let's switch on over. And here we go. We've got the title they have is Need a Checkup? Controversial fitness company, CrossFit, wants to be your doctor. Would you let them be your doctor? Think about it. I don't know. Let's go find out. So we got the CrossFit guy doing a jump rope with an amazingly big fat rope out in the parking lot. Very indicative of CrossFit, right? All right. So Jamie wrote the article, and he had an opportunity to interview CEO Roza. And they kind of started out talking about, just access to healthcare and also if the author has a primary care physician, just to kind of talk about it. And, Jamie says he doesn't, and Roza says, well, see, that's just what the problem is. You're not really seeing the value. It takes time. It takes money. So you don't have a primary care physician. That's what we're trying to fix. We're trying to make it, make it so that folks who want to have access to a doctor and work on their health and their fitness have better access to that doctor. Now, right here, we have Roza says that the subscription-based telemedicine program is meant to replace the primary care, offering clients access to both a physician and a health coach who can help the patients draft and follow personalized plans in pursuit of their fitness, nutrition, and overall goals. Let's see what else we got here. CrossFit boasts first fitness company to offer its own primary care services. They talk about some other, let's call them other telemedicine kind or subscription-based, I think is probably a better way. The subscription-based medical companies or healthcare companies like Forward Health, they charge $149 a month to work with doctors who create personalized plan to maintain long-term health. So that's probably the closest kind of fit out there. They also mention One Medical, which offers easy to make appointments, on-demand virtual care, maybe more like Teladoc. You pay one price, $199 per year for a membership fee. And then there's this private medical, which I don't think really applies here. And it's basically more exclusive white glove kind of thing where they limit the number of patients that the doctor has to just 50 families. And it's about $40,000 a year. I'm not buying that one. That's a little too much for me. Although when it comes down to your health, and if you want to really have, access to a doctor essentially on staff at your house, in some sense, that's how you do it, I guess. All right. So all these models are a little bit different. Let's see. Who is goal? Okay. So we have, the success of these businesses demonstrates that people are willing to pay to skip the line. I don't know if it's so much about, skipping the line and just getting, individual, easy access necessarily. Might be individualized attention. I think it's a little more of that. So his big concern at an overall system level with membership fees is you're going to systematically exclude individuals with limited income. And I think that is always a controversy and a problem with, these subscription-based kinds of things, and even CrossFit itself, right? I mean, a CrossFit membership, where we're paying monthly at a premium to have coaches working with us and putting together the programs and everything, is something that not everybody is going to be able to access. And you could argue that people who need it the most are just not going to come in necessarily and sign up for a CrossFit membership. They're going to maybe sign up for Planet Fitness or something like that, where there is not that much help and coaching and accountability. So that controversy kind of continues in this whole realm. says primary care doesn't seem like the most obvious match for CrossFit. To start, it's been part of the healthcare system until now. So I think that's kind of like the disruptive part. We're all kind of familiar with things are changing and, we're not doing things the same way we've done them before. And there's no reason why we should continue doing something the old way if there might be a better way. Precision Care is part of Roza's effort to make CrossFit healthier, partially inspired by his own experience with direct care. He says that people deserve better than today's primary care model is an honest statement. He says, I don't say that to be controversial. So, CrossFit and health has been something that CrossFit really has been promoting for years. So it's not really a new thing. I think the innovation here is that, they're really taking that primary care physician role into the circle of kinds of things that you can receive from the CrossFit brand. Okay. Let's see. CrossFit Precision Care has not officially started up yet. Allowing people to sign up. And 8 people in 8 U.S. states to join the wait list. Dr. Julie Fouché. Let's see here. They're matched with the doctor and a health coach who develop a personalized health plan for each patient. We did talk about this before, virtual appointments to help their charges stay on track. It doesn't really make sense to me. And let's see, describes it as a though Roza describes it as a replacement for primary care, there are limitations since the whole thing is virtual. All right, so we're not having a doctor come out to the gym to see folks, okay? You couldn't go for a flu shot or a physical exam, for example, okay? But it is really more toward the preventative side. We did talk the last time we got together about if you have a chronic condition, then they're likely going to be referring out and you're going to be seeing a local doctor anyway. Let's see what else we got in here. The program's largely focused on correcting those issues with individualized recommendations about sleep, fitness, and diet based in part on a client's blood and DNA test results. Personalized medicine of this sort is a promising field, but also new and largely unproven one. So I did get to see a little bit more about, the kinds of information and data that is being used. And the one aspect that is new or novel is going to be the genetic DNA testing. And we'll kind of get together and talk a little bit more about that. I'll make a different video on that where, hey, can I tell from my genes what my health outcome is going to be, or what, kinds of things are going to be better for me. Maybe I should be eating potatoes instead of sweet potatoes and something else. I don't know. Or is it something else? And, so we'll look more into that aspect of it. I think that is a very new part of, CrossFit, or a new part of healthcare, right? Can our genes and DNA tell us something about what kinds of things we should be doing to stay fit and healthy? I don't think that has been definitively answered, right? So we'll have to kind of dig into that a little bit more. Subscriptions are priced around $100 a month. Indeed, a money-making opportunity for CrossFit. It could be huge, right? We saw that CrossFit filed for a couple of trademarks that would allow them perhaps to market some supplements and whatnot. So we got to kind of be careful how we're navigating this, right? Because there's always a push and pull between, the money aspect of it and what is the advice and whatnot. And do we trust that, and are we getting good results? And then we're willing to pay for that. Or is it just another supplement thing, diet pill or whatever, that doesn't provide long-term results? So we'll have to kind of dig into it a little bit more and see. But of course, I tend to kind of have an open mind. And so we'll have an open mind and kind of see what we can learn about it as more information comes out. All right, got someone from Harvard Medical School. Let's see. guesses that the program's affiliation with CrossFit means it will largely attract people who have disposable income. So we already talked about like that access to healthcare and how that could be controversial. But you're kind of marketing to people maybe who are already doing CrossFit. So they, we're going to possibly have, we're spending money on our health and our fitness by spending money on a CrossFit gym and a CrossFit membership. We value being fit and healthy. So if we have some money to spend, we may be more likely to spend it here. It's really designed for people who are affluent, who probably would have done just fine anyway. And I think that is also something that we have to consider, right? I mean, there are some real chronic diseases and things that are out there, severe obesity, metabolic syndrome, and things like that, or diabetes, where, a person hasn't had the benefit of the, nutritional coaching and understanding what they should or shouldn't eat. And they're filling their grocery cart up with a lot of processed foods and a lot of sweetened beverages and things like that, because we just don't know. And that's maybe where we really can have the biggest impact. But here's the dilemma, right? I mean, those aren't the folks necessarily that are signing up for $100 a month to have a health coach specifically working for them. So maybe there's an opportunity to somehow bridge that and really kind of help our communities to get better, be healthier, and things like that. We have, in some sense, an obligation to share with our friends, with our family, the kinds of things that are going to make us and keep us healthy and kind of stave off chronic disease. All right, so I think we're finishing up here. CrossFit Roza sees it differently. In his view, the traditional system has had a chance and it failed, and he wants to be an outsider and to step in and to fix it. We know how to keep people healthier than a traditional health system, Roza says, so let's give that a try. And I am back. Thank you guys so much for walking through this article from Time with me to see if we can get a little more information about what this CrossFit Precision Care is. I had applied on the wait list. I don't think I've seen anything back other than an email just sort of recognizing you did apply to be on the wait list. So thank you for that. But I haven't gotten any details, I don't think, from CrossFit HQ on the program. So we'll keep our eyes open, and we'll keep sharing it with you as we learn more. Thank you guys so much for checking in. Take care and have a good day. Peace.